Sciatic pain is one of the most common yet misunderstood problems affecting adults over 50. It is not simply back pain. It is nerve pain, sharp, burning, radiating from the lower back down the leg end. If ignored, it can quietly steal mobility, sleep, and independence. The good news is this: in most cases, sciatic pain can be reduced safely with the right movement. Not medication alone. Sciatic pain after the age of 50 is a condition that affects millions of older adults and often interferes with daily life in ways that are both physical and emotional. It is important to understand that sciatic pain is not a disease itself, but a symptom caused by irritation or compression of the sciatic nerve, the longest nerve in the human body. This nerve begins in the lower spine and travels through the hips, buttocks, and down each leg. When pressure is placed on this nerve, pain can radiate along its entire pathway, creating discomfort that ranges from mild tingling to sharp, burning, or stabbing sensations as the body ages. Natural structural changes occur in the spine. Spinal discs gradually lose moisture and elasticity, reducing their ability to cushion the vertebrae. This can lead to disc bulging or herniation, which may press against the sciatic nerve. In addition, age-related conditions such as spinal stenosis and degenerative disc disease become more common after 50, further narrowing the spaces through which nerves pass. Weakening of the core and hip muscles also plays a significant role, as these muscles are essential for supporting proper spinal alignment. Lifestyle factors contribute significantly to sciatic pain in older adults. Prolonged sitting, especially with poor posture, increases pressure on the lower spine and irritates the sciatic nerve. Many seniors reduce physical activity due to fear of pain or injury, but inactivity leads to muscle stiffness, reduced circulation, and increased nerve sensitivity. Excess body weight can add further strain to the spine, accelerating nerve compression and inflammation. Sciatic pain after 50 often presents differently than in younger individuals. Pain may persist longer, flare up more easily, and recover more slowly. Nighttime discomfort, leg weakness, and difficulty standing or walking for long periods are common complaints. These symptoms can gradually reduce independence, leading to reliance on pain medications that may cause unwanted side effects. Understanding sciatic pain is the foundation for effective management. Pain is a signal that something in the body needs attention, not avoidance. With proper education, gentle movement, and targeted exercise, many older adults can reduce nerve irritation, restore mobility, and prevent recurring episodes. Addressing the root causes rather than masking symptoms allows the body to heal safely and naturally, even after the age of 50. For many adults over the age of 50, the first reaction to sciatic pain is to stop moving and rest as much as possible. While short periods of rest may reduce discomfort during severe flare-ups, prolonged inactivity often makes sciatic pain worse rather than better. The human body is designed for movement, and when movement is removed, muscles weaken, joints stiffen, and nerves become more sensitive. In the case of sciatic pain, excessive rest can increase pressure on the sciatic nerve and delay recovery as people age. Muscle mass naturally declines, especially in the core, hips, and lower back. These muscles play a vital role in supporting the spine and maintaining proper posture. When movement is avoided, these muscles weaken further, causing the spine to lose stability. This instability places additional strain on spinal discs and joints, increasing nerve compression. Exercise, when done correctly, strengthens these supportive muscles and helps restore balance to the body. Gentle exercise also improves blood circulation, which is essential for nerve health. The sciatic nerve relies on a steady supply of oxygen and nutrients to function properly. Prolonged sitting or lying down reduces circulation to the lower back and legs, allowing inflammation to build up around the nerve. Low-impact movement helps flush out inflammatory substances and promotes healing without stressing the joints. Another important reason exercise is safer than rest is its effect on flexibility and mobility. With age, connective tissues become less elastic, and prolonged inactivity accelerates stiffness. Tight muscles, especially in the hips, hamstrings, and lower back can pull on the spine and irritate the sciatic nerve. Controlled stretching and movement reduce tension, allowing the nerve to glide freely and decreasing pain over time. Exercise also plays a crucial role in restoring confidence. Many older adults develop fear of movement after experiencing sciatic pain, worrying that activity will cause further injury. This fear often leads to a cycle of avoidance, weakness, and worsening pain. Gentle, guided exercise breaks this cycle by teaching the body that movement can be safe and beneficial. As strength and mobility improve, confidence returns. Daily activities become easier rather than pushing through pain. Appropriate exercise respects the body's limits while encouraging healing. It supports long-term recovery by addressing the underlying causes of sciatic pain instead of temporarily masking symptoms. For adults over 50, movement is not a risk when done properly. It is one of the safest and most effective tools for lasting relief and improved quality of life. The goal of these 4 exercises is not to force the body into painful positions or to demand high levels of physical effort. They are carefully designed to work with the natural changes that occur in the body after the age of 50. At this stage of life, the spine, joints, and muscles require support, control, and gentle stimulation rather than aggressive movement. These exercises focus on restoring balance in the body while protecting the spine and calming the irritated sciatic nerve. One of the primary objectives of these exercises is to reduce pressure on the sciatic nerve. When muscles surrounding the lower back, hips, and pelvis become tight or weak, posture and increase nerve compression. These exercises gently release tension in the areas most commonly responsible for sciatic irritation by improving alignment and reducing muscle tightness. The nerve is given space to recover and function normally. Another important goal is to strengthen the muscles that support the spine. Weak core and hip muscles place excessive strain on the lower back, increasing the likelihood of nerve pain. These exercises activate deep stabilizing muscles without overloading the joints. Strengthening these muscles helps the spine maintain proper positioning during daily activities such as walking, sitting, and bending, reducing the risk of recurring pain. Improving flexibility is also a central purpose of these movements. As the body ages, muscles and connective tissues naturally lose elasticity. Stiffness in the hips, hamstrings, and lower back restricts movement and increases tension along the sciatic nerve pathway. The exercises encourage slow, controlled stretching that improves mobility while keeping the body relaxed. This allows the nerve to move smoothly without irritation. These exercises are also designed to rebuild confidence in movement. Many older adults associate pain with damage and become fearful of physical activity. By introducing safe, predictable movements, the exercises teach the nervous system that movement can be healing rather than harmful. This reduces fear-based muscle guarding, which often contributes to ongoing pain. Finally, the long-term goal is prevention. These exercises are not only for pain relief, but also for maintaining spinal health and independence. Practiced regularly, they help reduce future flare-ups, improve posture, enhance balance, and support an active lifestyle. They empower adults over 50 to take control of their health through consistent, gentle movement that supports both physical comfort and long-term well-being. For adults over the age of 50, one of the most common misunderstandings about exercise and pain relief is the belief that harder effort produces faster results. When it comes to sciatic pain, this mindset often leads to frustration or injury. The body at this stage of life responds far better to regular, gentle movement than to intense or forceful exercise. Consistency allows tissues to adapt gradually. While excessive intensity can increase inflammation and nerve irritation, the sciatic nerve is sensitive, and sudden or aggressive movements can aggravate it. Performing exercises with high intensity may overstretch muscles or place sudden pressure on the lower spine, causing setbacks instead of progress. Gentle, repeated movements allow the nervous system to relax and adapt. Each session builds upon the previous one, sending a message of safety to the body rather than triggering a protective pain response. Consistency also plays a crucial role in muscle conditioning. Muscles weaken and tighten gradually over time, and they recover in the same way. Short daily exercise sessions help maintain muscle activation, improve circulation, and prevent stiffness from returning. Skipping days or exercising only occasionally forces the body to repeatedly restart the healing process. Regular movement keeps muscles flexible and supportive, reducing stress on the sciatic nerve. Another important benefit of consistency is improved circulation. Nerves require a steady supply of oxygen and nutrients to heal properly. Daily movement enhances blood flow to the lower back and legs, reducing inflammation and promoting tissue repair. Intense workouts performed infrequently cannot provide this sustained benefit and may actually limit circulation due to muscle tightness or soreness. Afterward, consistency also supports mental confidence and emotional well-being. When progress is steady and predictable, fear of movement decreases. Older adults who move regularly begin to trust their bodies again. Pain becomes less threatening, and daily activities feel safer and more manageable. This confidence is essential for long-term recovery. Fear and stress can amplify nerve pain. Small, controlled efforts practiced every day create lasting change. 10 to 15 minutes of gentle exercise can be more effective than an hour of intense activity performed irregularly. The body heals through repetition, patience, and respect for its limits. Over time, consistent movement restores strength, flexibility, and comfort, proving that steady progress is far more powerful than pushing too hard. When dealing with sciatic pain after the age of 50, understanding and respecting warning signs from the body is essential for safe recovery. Pain is not something to ignore or push through, especially nerve pain. The body communicates clearly when a movement is helpful and when it is harmful. Learning to recognize these signals can prevent worsening symptoms and long-term complications. One of the most important warning signs is sharp shooting pain that travels down the leg during or after exercise. This type of pain often indicates increased nerve irritation rather than normal muscle stretching. Unlike mild discomfort or tightness, nerve pain is usually sudden, intense, and specific in its pathway. Continuing to exercise through this pain can inflame the sciatic nerve further and delay healing. Numbness, tingling, or a pins and needles sensation that increases with movement should also be taken seriously. These sensations suggest that the nerve is being compressed or overstressed. While brief, mild tingling may occur initially, persistent or worsening symptoms are a signal to stop and reassess. Ignoring these signs can lead to prolonged nerve sensitivity and weakness. Muscle weakness is another critical warning sign. Difficulty lifting the foot, standing up from a chair, or maintaining balance may indicate that nerve function is being affected. This is not normal muscle fatigue and should never be dismissed. Weakness suggests reduced nerve signaling to the muscles. And continuing strenuous activity under these conditions can increase the risk of falls and injury. Pain that worsens at night or disrupts sleep is also an important signal. Sciatic pain that intensifies while lying down or turning in bed may indicate ongoing inflammation or poor spinal positioning. If exercise increases nighttime pain, the intensity or technique needs adjustment. Restful sleep is vital for nerve recovery, and anything that interferes with it must be addressed. Emotional warning signs matter as well. Fear of movement, anxiety about pain, or frustration with slow progress can cause the body to tense up, increasing nerve irritation. Respecting these signals means slowing down, modifying movements, and focusing on relaxation and breathing. Healing is not about enduring pain, but about working within safe limits. When warning signs are respected, recovery becomes smoother and more predictable. Listening to the body protects nerve health, supports confidence, and allows exercise to remain a safe and effective tool for long-term relief. Regaining independence and confidence is one of the most important outcomes for adults over the age of 50 who are dealing with sciatic pain. Persistent nerve pain often affects more than just the body. It changes behavior, routines, and self-belief. Many individuals begin to avoid walking, bending, or even simple household tasks out of fear that pain will return or worsen. Over time, this avoidance can lead to reduced mobility, isolation, and a growing dependence on others. When sciatic pain limits movement, confidence gradually erodes, Everyday activities such as getting out of bed, climbing stairs, or standing for long periods begin to feel risky. This constant caution can create tension in the muscles, which further irritates the sciatic nerve. Gentle, consistent exercise helps reverse this cycle by showing the body that movement can be safe and controlled. Each pain-free movement builds trust between the mind and the body. As strength and flexibility improve, daily tasks become easier. Walking becomes more stable, balance improves, and posture naturally aligns. These changes reduce the strain on the lower back and legs, allowing individuals to move with less effort and less fear. The ability to perform routine activities without pain restores a sense of control and self-reliance that many seniors believe they have lost. Reducing dependence on pain medications is another important step toward independence. While medications may provide temporary relief, long-term use can bring unwanted side effects such as dizziness, fatigue, or digestive issues. As pain decreases through movement and strengthening, many individuals find they rely less on medication and feel more alert, active, and engaged in daily life. Confidence also grows from understanding the body. Knowing which movements help, which positions protect the spine, and how to respond to discomfort empowers older adults to manage their condition effectively. This knowledge removes fear and replaces it with awareness and confidence in self-care. Regaining independence is not about returning to youthful strength, but about moving comfortably and safely within one's limits. With patience and consistency, sciatic pain no longer controls daily decisions. Confidence returns as movement becomes easier, routines are restored, and life feels active again. This renewed sense of independence supports not only physical health, but emotional well-being and quality of life. Sciatic pain after the age of 50 does not mean the end of an active or independent life. It is a signal from the body asking for attention, care, and the right kind of movement. Throughout this video, the focus has been on understanding the real causes of sciatic pain, why avoiding movement often makes it worse, and how gentle, targeted exercises can support healing rather than cause harm. Relief does not come from pushing harder or ignoring pain. It comes from consistency, patience, and respecting the body's signals. Small daily efforts can reduce nerve pressure, improve circulation, restore strength, and calm inflammation. Over time, these changes work together to reduce pain and prevent future flare-ups. Equally important is confidence. Fear of movement keeps many seniors trapped in discomfort. When movement is done safely and correctly, confidence returns, mobility improves, and independence is restored. Simple actions like walking, sitting comfortably, or sleeping without pain become possible again. These exercises are not just about pain relief. They are about protecting spinal health, reducing reliance on medication, and maintaining quality of life. Age does not define physical ability. How the body is cared for does. Start gently, stay consistent, listen to your body, and allow progress to happen naturally. The path to relief is not fast, but it is steady and achievable. With the right approach, sciatic pain does not have to control daily life. Movement, when guided wisely, becomes one of the most powerful tools for long-term comfort, strength, and independence.